My name is Fertleman. I'm a consultant paediatrician at the Whittington, and I've been a consultant now for 10 years. I was at Cambridge, then I was at the London, then I did my foundation, well, they were called house office jobs at Whips, and then I did a sort of my own training path because this was pre-Calman in paediatrics. They're all free, and the Homerton and the London. And then I became a registrar, so I did a year at the North Middlesex and then a year at Great Ormond Street. And then for personal reasons, for infertility, because I wanted to have infertility treatment, I took a sort of career break and worked at the Poisons Unit and Guy's, where actually I did get pregnant. And then for the next, so from 1996 until 2003, I was either pregnant, having babies, being on maternity leave, or coming back to work and working at UCLH and UCL, where I did my MD in a rare pain condition, and I did some education work and I did some clinical work. So that was quite a long time when my children were quite young, and then I went from being full-time to part-time, and then I had a bit of sort of clinical work left to finish off, and worked at the Northern Health Centre, which is community paediatrics in Islington, and at the Whittington. Took a little bit more time off to finish writing up my MD, and then finally, in fact, wrote my own job description for the consultant job that I have, interviewed for it, and thankfully got that job, and that was at the end of 2005. And then I've been here since then. Besides being a consultant paediatrician, which is 40% of my time, at the moment I'm the guardian for safe working, which is a new role, which is 10% of my time. I'm the site sub-dean, which means I'm in charge of all the undergraduates for UCL at this campus, which is 20% of my time. I'm still a training program director, although I'm about to give that up. So I'm in charge. I look after managing the paediatric program in North East, North Central London. That's 10% of my time, and my final 10% is I run a BSc at the Institute of Child Health and Whittington for paediatrics and child health. So at the moment I'm working 90%, but about to drop that. I bring my hobbies to medicine. So I'm a passionate knitter, and I'm just about to start running my first knitting holiday this November in preparation for retirement. I'm one of the world's great planners. So I've got all sorts of ideas mapped out about what sort of holidays I want to run and where I want to live. So I am very clear that on my day I don't work. I really endeavour not to do work. I do some work, and I'm flexible. So if I work on a Friday, then I'll take a different day off in lieu. I have 3 active, should we just say active children, and my husband's a lawyer, so he's not around that much. It's quite good though, because he does earn money, so that's nice. So I'm very much managing the children. I've also got a nanny who technically I don't really need, because my children are quite old, but actually it really helps me live the sort of life I want to live. So yesterday I had a guardian safe working meeting, and to spice it up a bit, I said I would bring in a chocolate fondue, and we all brought in food and sticks and chocolate fondue and made a bit of a mess in the meeting, but it was great fun, and my nanny managed to bring all the bits in, and in fact today she came along and collected it all. So it's being able to have that sort of flexibility, which I really love, so that I can be a host at a guardian safe working meeting, which technically is probably not going to be very exciting, but having a load of raspberries and chocolate dripping everywhere is clearly going to be quite fun. So, and one of my other passions is animals. I love animals, and so 2 of the things I started this year, which in fact I met 140 new medical students yesterday to introduce them to Whittington, and I basically used compassion as the theme, and I sort of talked about being compassionate to yourself, compassionate to others, including colleagues and patients, and then said the 2 things that I've done this year, which sort of mould 2 bits of that I've done for compassion, is I've started a twiddle muffs knitting group for staff here, and we knit twiddle muffs for patients with dementia, and that's been great because you can have cleaners and consultants and managers and porters all knitting together, so it's quite a nice leveller. And also my dog's now a trained Therapause dog, and I actually brought him in again to the lecture for 140 students at the end to say this is another way you can think about compassion, because being in hospital is lonely and boring, and lots of people do like dogs, and you can't really stroke your nurses, but you can stroke dogs. So that was, those were some of the things I've done this year, and have been really exciting. And I think being in a small organisation, being in a district general hospital, it's been much easier to do the knitting, much easier to do the therapause, the dog therapy. I think it would be more difficult in a bigger institution. The other thing that, in terms of how you manage your work-life balance, is everyone's themselves got to do what's right for them, leaving work on time, disconnecting if that's right for you. So I actually do answer my emails on holiday. Some people don't. That's completely fine. And as long as you're consistent and you don't get annoyed that your colleagues do things differently than you, then I think that great big difference between how we all practice and why we do medicine, and it's about the people and each person's different, is important. I just love the variety. I love being able to take new things on. I told you that I've become the guardian of safe working. I'm no longer going to become, I've handed my notice for my training programme director role. So I think the NHS is great if you've got a substantive post to be able to take things on and drop stuff. And I think that means that I don't have to jump cold into a brand new job, because actually that would be quite scary. So I think that's a great thing that the NHS does do that really well. I love being able to still practice medicine, being able to see patients, being able to help patients, and also being able to support trainees and increasingly colleagues to be able to be fulfilled and think about different ways of doing things or extending what they do. So those are the things I really enjoy. And I suppose, at the end of the day, medicine's a great career, and I think it's really easy to forget that. The things that I can't bear is all the mandatory training, or the trying to shoehorn people into a small box. Why is it I have to go on level 2 and level 3 safeguarding training? I've just written a textbook about it. Let's stop trying to mass produce people and shoehorn them into such a small, tight area. So I feel those are the things that drive me completely mad, is the sort of the inexorable and relentless mandatory training, which we know that people cheat at. We know that it's not really fit for purpose, and that's not how you learn. There's many better ways of doing that sort of training, and I think it's actually derisory and patronising to think that we all have to, that I can't work out how I do it myself. And I suppose part of me, and one of the reasons that I'm finding being a training programme director difficult now, is I feel that we've all these really bright, clever trainees who are in their 20s and 30s, and we're still telling them exactly where they're going to go and what they're going to do, and if they're going to pass their outcomes and not pass their outcomes, and we're not allowing them to do swaps. And I feel this, I just think it's patronising, and I can't bear it. I've tried hard to change it, and sometimes you can't. I mean, I still think general paediatrics is a great career. I think I don't see it in any way as a default position, and I don't want it to become grid. I don't think it really helps having all these different specialties, community as grid. It just again stifles and reduces the things you can do. I think that the more out of programme experiences people can do, the better, because then when you come to your general paediatric job, you're not jaded, and you've met lots of people along the way, and you're not going to do the same thing forever and ever. You're going to keep on changing. So I think, I think there are people who came here and they've never done rheumatology, but that's what we needed. So they became a rheumatologist, and we can do different things in different parts of our career. And I think that's, if you're a generalist, that becomes really possible. So I started off, and I don't particularly like babies, but I started much more with dealing with young children and being acute and attending and running all the education stuff locally. And now my practice is quite changed, and I get referred in complicated patients with huge mental health and emotional add-ons. And I think if you go in open and not restricted, then you'll find your niche. But your niche can change, and that's why I think general paediatrics is great. That it's like being a geriatrician, it's like a paediatrician. Anything, you can do anything, and that's for me great, because it stops you being restricted. It keeps you fresh. I probably see myself as planning my retirement. I'm now 51 and a third, and I want to go and live in Israel when I retire, or when we retire. My husband has to retire in 2 to 3 years' time, and I suspect I'll drop maybe some of my posts. I still want to carry on the paediatric work. I probably will stop the attending on the on-call because they seem to be linked, and do more chronic work and probably more work with paediatric mental health. So I sort of see myself maybe becoming even more sort of specialised within paediatrics, maybe dropping some of my educational roles. I still say myself based primarily here. I'm very happy here. I really enjoy working here. And then I want to do something completely different. So I'm planning to run knitting and quilting and other workshop type holidays in Tel Aviv. That's the long term plan. I think we need to think about how long we train for. I think 8 years is ridiculously long. I think 5 is probably plenty for most people, and I think we're very rigid how we train people. I would definitely like to see splitting SHO from registrars. And I think we need to be having sort of more primary care paediatricians and maybe working in different environments. I mean, I like this district general hospital type environment. But I think we could really improve access to paediatricians and paediatric advice using all the different communication tools we have now in primary care. So I think that's important that we push that. But I do think I don't think paediatrics is going to disappear. I don't think we're busy enough at the moment in this hospital. I think we need to think about other income streams, such as long-term ventilated patients, patients with mental health problems. I think there's a lot more we could be doing. Like we have the TB here, so there are ways in that places like Whittington could really, I think, could expand and excel. Things I do like that I think we're all probably post books, and I use Google like everybody else. But although I've written quite a lot of books, of course my books are great. So I like Medicines for Children. I think that's a particularly useful website. It's got lots of leaflets for parents about medicines. I really like that, and I do think the NHS advice, either the downloads or just if I'm looking up a condition I don't know about, I tend to put NHS, and I think that's really useful because it's sort of standardised. It's been well written, so that's a particularly useful website. And in fact, there was something about Plage Kefli that I disagreed with, because I didn't think it was as up to date as it should have been, and I petitioned them and they've looked at it and changed it. So I think that they're actually responsive as well. So those are my two, I suppose, top sides. But the bottom line is I work in a place with lots of people. Just before I started this interview, I was running around with a picture of a colleague's child's bottom that I wasn't quite sure what we should be doing with, and actually speaking to people and teasing things out is still probably the best way that I learn things. So resources are top, my colleagues, and that includes junior doctors. The person who actually gave the most sensible advice was the F1, in fact, on this particular case. Medicines for Children and all the NHS patient choices websites.